Hello. Welcome to this project thingy, whatever. My name is Gabriel, and today I'm going to be presenting to you a very common disease that affects a lot of people: hypertension and hypotension, which is high or low blood pressure. In this video, we will be exploring the abnormal function, causes, symptoms, prognosis, treatment, and prevention of hypertension/hypotension. So, my fellow peers, or just you missing, before we get into the subject of hyper and hypotension, we need to know where this disease is situated. This disease is situated in the heart, or rather, the circulatory system. The circulatory system function is to transport nutrients, respiratory gases, and metabolic products throughout a living organism, permitting integration among the various tissues. The circulatory system is composed of blood vessels in the heart, the blood vessels being as described. Arteries bring blood away from the heart. Arterioles bring blood away from the heart, but thinner. Both are round and muscular with very thick walls. Capillaries, present in beds, perform pulmonary and systemic circulation, which we will get into later. Venules bring blood back from the capillaries to veins, which bring blood back from venules and back to the heart. These vessels are thin and have valves to prevent backflow. Now, these blood vessels are obviously very important to our literal existence as human beings, as there are arteries and veins for specific parts of the body. Now, the circulatory system is split into two parts: systemic and pulmonary circulation. Firstly, let's start with pulmonary circulation. Pulmonary circulation is the blood going from the heart to the lungs to be oxygenated. The cycle is as follows. Deoxygenated blood obtained from the muscles goes into the heart, where the heart pumps it to the lungs using pulmonary arteries. At the lungs, the blood gets oxygenated through diffusion, in which it goes back to the heart via pulmonary veins. As for systemic circulation, the oxygenated blood enters the heart, in which it is pumped through the aorta to be distributed throughout the body. Now, obviously, the circulatory system is extremely important to us because it supplies our muscles with the oxygen it needs to carry out cellular respiration. Without it, we would die. Evidently, of course. Now, I would like to discuss one very big component of circulatory function, and that is blood pressure. Blood pressure, at its definition, is the pressure of circulating blood against the walls of the arteries. Because the heart can pump into the large arteries a greater volume of blood that can be absorbed by the tiny arterioles and capillaries, the resulting back pressure is exerted against the arteries. The dilation, contraction, elasticity, or anything that affects the heart's ability to pump blood will indefinitely affect its blood pressure. Blood pressure is measured using 2 points: systole, the high point where the heart contracts to empty the blood into the circulation, and diastole, the low point where the heart relaxes to fill with blood returned by circulation. This pressure is measured using millimeters of mercury and is carried out using an instrument called a sigma. Normally, a healthy person's blood pressure measures to be 120 to 180, where 120 is the systole and 80 is the diastole. Some factors that can influence blood pressure include rate of contractions, resistance of the vessels to the blood, and blood viscosity, which is thickness of the blood. Now, say you go into a doctor's appointment. Your doctor takes your blood pressure and wha-bam! Your reading is 130 and 80, or 90 or 60 millimeters of mercury. What happened? This disease, as aforementioned, is called hyper or hypotension. Hypertension is a higher blood pressure than usual, and hypotension is lower blood pressure than usual. These two are very different, which means that they would have different symptoms, causes, prognoses, and prevention. The causes. Firstly, let's talk about hypotension. Hypotension can be caused by a lot of things, but let's look at the top 3. Number 1. Dehydration. Dehydration can either be caused by fever, vomiting, severe diarrhea, overuse of diuretics such as alcohol, and strenuous exercise. When we become dehydrated, our blood volume decreases. When our blood volume decreases, less blood is flowing within our arteries. This would then cause our heart to work harder and the blood vessels to constrict in order to compensate for the loss of blood pressure. Number 2. Blood loss. Similar to dehydration, blood loss can cause a severe drop in blood pressure. For example, if you get slashed in the stomach, you will obviously bleed. This blood loss will then lead to, you guessed it, decreased blood volume. This decreased volume will then lead to decreased blood pressure, which then, as I said before, causes hypotension. And lastly, lack of nutrients. Now, let's talk about the urinary system here. Aldosterone, which is a hormone secreted by the adrenal glands, acts on the kidney, which produces urine to retain sodium and water as well as excreting potassium. If sodium is too low, this may cause hypotension. This is because the kidney no longer needs to hold water to wash out sodium, which is a mineral, out from your body. This will then be excreted in urine, which in turn causes a decreased blood volume. Now, what does decreased blood volume cause? I don't know. Hypotension, you dummy. Now, there are 3 other types of hypotension, but we will not be going too much into detail about them. But here are their names. Orthostatic hypotension, which is hypotension caused by standing up too quickly. Postprandial hypotension, which is hypotension after eating. And lastly, neurally mediated hypotension. This condition is caused by exercising or standing for a long time. Now, since we've got hypotension out of the way, let's talk about hypertension. There's 2 types of hypertension, primary hypertension and secondary hypertension. Primary hypertension is caused by age. As we get older, our blood vessels start to become stiffer and less compliant. This is because the elastic tissue in our arteries decreases over time. This would eventually cause an increase in blood pressure. As for secondary hypertension, there are 4 main causes. Number 1, too much sodium in the diet or too little potassium. If the body has too much sodium and too little potassium, the kidney would not be able to take that much sodium and excrete it in urine. This causes sodium to sit in the blood vessels, which increases blood volume and in turn increasing blood pressure. Number 2, obesity. When a person gains weight, their body needs to supply more oxygen and nutrients to their tissues. The blood flow through their blood vessels increases, which then means the pressure on their artery walls increases as well. Number 3, family history. Unfortunately, high blood pressure also runs in families. This means that if your parents were hypertensive, you would likely be hypertensive yourself. And lastly, lack of physical activity. As I've learned from my heart rate lab, people whose hearts are not fit tend to have higher heart rates. This means that their heart needs to work harder during each contraction to distribute oxygenated blood to their tissues, which may then cause an increased force on your arteries. Symptom. Now that we know the causes, what are their symptoms? As for hypertension, hypertension is actually known as the silent killer, which means that there are no symptoms. Worst thing is, even if blood pressure readings are dangerously high, you wouldn't know. Hypertension, however, may cause headaches, shortness of breath, or nosebleeds, but one could just shrug these things off as events of chance. Even so, these symptoms don't occur until blood pressure has reached a high that threatens the life of the patient. Hypotension, on the other hand, is much more conspicuous. It is accompanied by dizziness or lightheadedness, fainting, blurred or fading vision, nausea, fatigue, and lack of concentration. On the extreme side, which is called hypotensive shock, causes confusion, cold, clammy, or pale skin, rapid, shallow breathing, and weak/rapid pulse. All of these are caused by lack of blood flow to a specific area. Prognosis. In hypotension's case, it is not considered a serious health problem, especially when doctors can treat the underlying condition that causes hypotension. However, hypotension may cause injuries when the patient faints and falls. Additionally, if not treated, the brain and other organs are not able to obtain the blood they need and may result in organ failure. In severe cases, hypotension may cause shock, which may lead to stroke, heart attack, or kidney failure. So no, you would not die if you seek treatment. As for hypertension, its outlook depends on how well the patient follows a healthy lifestyle and controls their high blood pressure. Once diagnosed, if the patient takes their medication, has a low-salt diet, is physically active, and are not overweight, then its complications may be minimized. However, if the patient does not tend to their hypertension, then the following complications may occur. For example, hypertensive crises, which may be accompanied with headaches, nosebleeds or instability, stroke or angina, and some chronic complications would be heart failure, chronic kidney disease, arterial stiffness, vision loss, and left ventricle hypertrophy. Despite that, no, you would not die if you seek treatment and follow your doctor's advice. Okay, that was a lot of information to take in. Feel free to pause this video just to take a little break from marking everybody's presentations. I know you need it. Unless I was the first video you decided to watch. In that case, this is awkward. Now that breaks over. Let's take a... Okay, now that breaks over, let's discuss treatment, prevention, and conclusion. As for hypertension, the treatments include, but are not limited to, diuretics, which are drugs that make you pee more, which decreases your blood volume and in turn decreases your blood pressure. ACE inhibitors, also known as angiotensin converting enzyme inhibitors, they help relax blood vessels by inhibiting the development of aldosterone, a hormone that increases blood volume by stimulating the reabsorption of sodium and water. And lastly, calcium channel blockers. Just like its name, calcium channel blockers block the channel of which calcium enters the cell of the heart and arteries. Calcium is a mineral that helps our blood vessels contract more strongly, and by blocking their protein channels, they help the blood vessels relax much more. Now, there are much more medications that treat hypertension, but unfortunately we are not able to go in depth on it. Feel free to pause to read these. As for hypotension, the type of hypotension that does not cause signs or symptoms is very mild and rarely needs medication. For general hypotension, however, some of the treatments are consuming more sodium and drinking more water, both of which increase your blood volume and your blood pressure. However, hypotensive shock is a much more serious and fatal case, in which the patient's organs could literally fail. Severe hypotension must be treated immediately at a hospital where the emergency personnel can give the patient fluids and possibly blood products to increase blood pressure and stabilize vital signs. Now that we know the treatment, how can we prevent ourselves from getting this disease in the first place? For hypertension, prevention could be limiting sodium consumption to stabilize blood volume and in turn blood pressure, regular exercise and eating a heart-healthy diet to improve cardiovascular health and strength, and maintaining a healthy weight to keep the load light on the heart. For hypotension, eating fewer carbohydrates can ease up postprandial hypotension, which slows the absorption of glucose. Staying hydrated and avoiding alcoholic drinks help keep the blood levels in check for optimal blood pressure. Rising slowly instead of quickly, as aforementioned, can help with orthostatic hypotension. And lastly, wearing compression stockings to prevent pooling in the legs. And we're done. Can you believe it? Let's summarize what we've learned, shall we? The circulatory system is a system that transports oxygen and nutrients to our tissues and back. They are composed of arteries, veins, and capillaries. Blood pressure is the force exerted on arteries. Hypertension is too much blood pressure, and hypotension is too low blood pressure. Hypotension is caused by dehydration, blood loss, and lack of nutrients. There are 4 types of hypotension. Orthostatic is when you're dizzy when standing up, postprandial is dizzy after eating, and neurally mediated is dizzy when standing or exercising for a long time. As for hypertension, it is caused primarily by age and secondarily by too much sodium, genetics, obesity, and lack of physical activities. Hypotension can cause dizziness, lightheadedness, fainting, blurred or fading vision, nausea, fatigue, and lack of concentration. However, in serious cases such as hypotensive shock, it can cause confusion, cold, clammy, or pale skin, rapid or shallow breathing, weak or rapid pulse, and even organ failure. Hypertension, however, does not have any symptoms and is called the silent killer. It may be accompanied by headaches, nosebleeds, or shortness of breath, but these may be shrugged off. Hypotension is not considered to be serious. You would not die if you seek treatment. In serious cases, however, you may die from organ failure if you do not receive medical aid. Hypertension is also not considered to be serious, depending on the patient's attitude towards treating it and living a healthy lifestyle. You would not die if you are actively acting against it. Hypertension can be treated with diuretics, ACE inhibitors, calcium channel blockers, and these. Hypotension rarely needs medication. In some cases, fludrocortisone treats orthostatic hypotension. Also, more ways to treat hypotension is consuming more sodium or drinking more water to increase blood volume and increase blood pressure. In case of hypotensive shock, seek emergency treatment. To prevent hypertension, limit sodium consumption, exercise regularly, eat a healthy diet, and maintain a healthy weight. To prevent hypotension, eating fewer carbs can ease postprandial hypotension, staying hydrated and avoiding diuretics such as alcohol to keep blood volume stable. Rising slowly can prevent orthostatic hypotension. And lastly, wearing compression stockings can prevent pooling in the legs. Okay. I'm done now.